Hello everyone. Welcome to the FABC's first vet question and answer session. I'm just going to give people a few minutes to get logged in and make sure that we've got everyone. So in the meantime, I'll tell you a little bit about the FABC and who we are and what we're trying to do. So I'm Emma, I'm one of the committee members and I'm on the veterinary subcommittee. We are very keen to increase vets' understanding of behaviour and to give them a source for finding good behaviour advice. The FABC is a professional body representing accredited behaviourists, so all of our certificated members have been independently accredited to meet the standard required by the Animal Behaviour and Training Council for listing. So we know that is a good place to look for help. We are trying really hard to get lots of good resources up for you guys, so lots of stuff on our website. If you've not already seen it, we've got a veterinary blog which is giving out loads of great information, and we're really keen for you to get in contact with us and let us know what would be useful and what you would like to see. So there's some of the things that we're trying to do. I'm just seeing some messages coming in, so I'm hoping you can all hear me and that this is all working the way that it should be. This evening, this is the first of these sessions that we're going to run, and the idea is that we're going to do a brief introduction to the topic, and then we will switch over and take your questions and hopefully be able to answer as many of those as we can. So get thinking about the things that you really want to know, and we'll hopefully be able to get through as many of those as we can this evening and give you as much information as we can. I'm probably going to hold off starting the presentation just for a few minutes, just so that we can make sure that everyone who wants to attend has got themselves logged in and registered and organised, and then we will think about making a start. So our topic this evening is feline toileting problems, which I know is a really common problem that lots of you are going to be seeing in practice. I'm going to be running a poll in a moment, which I'd be really grateful if people could just click on and answer for us, just to check out who we've got here this evening so that we can target these better in the future to know who's attending and who's interested. So our speakers tonight, we've got two people who are going to be fielding your questions. I've got Trudi Atkinson, who is a registered veterinary nurse and a FAB clinician's BVNA and ISFM liaison officer. She's also a member of our veterinary subcommittee. She's a certified clinical animal behaviourist specialising in feline behaviour and the author of Practical Feline Behaviour, Understanding Cat Behaviour and Improving Welfare. And she is currently writing a book concentrating solely on feline house soiling. So she clearly is the person to direct your questions to. We also have the lovely Caroline Warnes, who is a certificated animal behaviourist. Sorry, I'm just going to find my notes so I can tell you exactly what she said. Bear with me. Okay, so yeah, Caroline is an ASAB accredited certificated clinical animal behaviourist, and she's a Royal College of Veterinary Surgeons recognised advanced practitioner in companion animal behaviour. For the last 20 years, she's been running a companion animal behaviour referral practice near Swindon in Wiltshire, and her particular interests are the link between medical problems and problem behaviours and the role that psychoactive medication can play in the treatment of behaviour cases. So obviously she'll be able to take any vet questions that you might have, and hopefully between the three of us we'll be able to answer your questions. So what I'm going to do is run the presentation, which, like I said, will be a short presentation, and then hopefully we can get around to doing some questions. If you do have any questions that you think about during the presentation, if you look on the side of your screen, there is a little box that you can enter chat questions in. If you just click on the chat logo and type in your question in the comments box, then I will be able to see those and we will read them out for our presenters to answer them. If you have a particularly complicated question or you want to expand upon it, there is an option at the bottom of the options to speak oh, I'm being told that on yours it might be at the top, to speak, which is like a hand symbol, and if you click on that you can request to be nominated to speak, and we can do that and get you on so that you can speak live and put your question across. Okay, so let's get on and get the presentation started. Okay.
Hello everyone, and welcome to the very first Fab Clinicians Vet Professional Q&A session. To start with, I'm going to do a very quick run through tonight's subject, which is feline house soiling, which I hope will provide you with a few answers, but even more so I hope will inspire you to ask us questions afterwards, which we will do our very best to answer for you. So to begin with, a bit on terminology, starting with what do we mean when we talk about house soiling. House soiling is actually a really nice blanket term referring to the deposition of urine and or feces within the home in a location that is undesirable for the owner or caregiver, regardless of the underlying cause, intention or physical position adopted by the cat. So, in other words, it is a fairly good and preferable generalized term to use, especially when referring to a case before an underlying cause has been established. Other acceptable terminology include pureuria, referring to the deposition of urine in undesirable or unusual locations, spraying, which refers to passing urine backwards from a standing position, which may or may not be urine marking. There can actually be other reasons why a cat might adopt this position. Urine marking, the deposition of urine usually onto a vertical surface via a standing position for the purpose of olfactory communication. And finally, middening, the deposition of feces as a form of scent and also possibly visual marking, although there is some debate as to whether or not cats do actually use feces for marking or not. One phrase that you are likely to hear and may possibly even use yourself is inappropriate, as in inappropriate urination or inappropriate defecation. This is also a term that most of us have used in the past, but now do prefer to avoid. The reason for not wanting to use this term is that house soiling can only be inappropriate as far as the owner or caregiver is concerned. It can never be inappropriate as far as the animal is concerned. Plus, the word inappropriate can imply that the animal is intentionally acting inappropriately and is therefore at fault. This suggestion could further harm the cat-owner relationship and in turn could even hinder resolution of the problem. So, now let's just have a quick look at some of the most common underlying causes, starting with litter tray issues. One of the first things to establish is if a litter tray has actually been provided for the cat. A cat might normally toilet outdoors, but there can be any number of different reasons why a cat might become unwilling or unable to do so. But until these reasons have been identified and successfully addressed, the cat will need to have access to at least one indoor litter tray. I say at least one because many cats prefer to have one area to urinate and a separate area to defecate. And in multi-cat households, there can also be a reluctance to share litter trays, which is why the standard recommendation is to use one litter tray per cat plus one extra, although in some households even more than this can be required. Regarding positioning of litter trays, I'm sure most of you are well aware that it is unadvisable to place litter trays close to other resources, especially food, but it is just as important that litter trays are kept well away from areas where the cat is likely to be disturbed or where it might feel at threat. Such places to avoid can include walkways, next to frequently used cupboards, near to glass doors or floor-to-ceiling windows through which other cats might be seen, or close to the cat flap or other entrances and exits. It's also best to ensure some distance between litter trays. If the cat does prefer to use separate areas for urination and defecation, these separate areas won't be provided if the litter trays are located next to each other. However, it can also be a problem if litter trays are positioned too far apart. This is because the act of urinating may also stimulate the cat's need to defecate and vice versa. So if the cat is one that prefers to use separate areas, and the nearest other litter tray is one that is in a different room or on a different level of the house, then the cat might choose or have no other option than to defecate or to urinate in the same room, but at a distance from the litter tray that has just used. This can be seen here in the photo, where the cat has urinated in the litter tray and then defecated, which is marked with the arrow about a metre or so away. However, in multi-cat households, litter trays might also need to be provided in other areas of the house to avoid or to address issues of blocking or direct conflict. Another very common problem I come across are litter trays that are too small. The recommended size for a litter tray is one that is 1.5 times the length of the cat, excluding its tail, but some cats can actually require one that is even bigger to enable it to use it comfortably. In this video, you'll see that the cat is still using the litter tray, but it is obviously far too small for it, and it just can't use it comfortably. You'll also notice that the cat has a raised tail and is adopting a slightly semi-standing position. I have seen cats in other small litter trays adopt a far more fully standing position, which is then reported by the owner that the cat is urine marking. But this is actually more likely to be due to the cat having to adopt a spraying type position, because this is the most comfortable position it can adopt to pass urine in such a cramped space. But it's not just litter trays that can be an issue. The litter substrate can also play a part in house soiling. Generally, most cats do prefer to use a fine clumping litter, but some can develop an individual preference for particular textures and even possibly particular scents of litter substrate. House soiling may then occur if there is a sudden change from this preferred substrate. Pelleted litters can be well accepted and can even be a preference for some, but they can also be uncomfortable to walk on or dig into if the cat has any form of injury, degenerative joint disease, or even sore feet. Cats have a very highly sensitive sense of smell, therefore scented litters or those that produce a scent when wet are generally best avoided. This highly sensitive sense of smell might also explain why some cats are so fastidious about unclean litter substrate. The quantity and not just the quality of the litter substrate can also be a very important factor. A cat needs to have sufficient depth of substrate to be able to comfortably dig into it. Plus, the more substrate that is provided, the more that it can be used before it needs cleaning. Generally, an overall depth of at least 2 to 4 centimeters should be provided, or this might actually need to be quite a bit deeper for a large cat or in a shared litter tray. There are other things that are also best avoided. For example, litter tray liners, especially plastic ones, which can then snag on the cat's claws when it tries to dig into the litter. Self-cleaning or easy clean litter trays, although these may appear to be a good idea, they can cause problems. The simplest type of these usually consists of nothing more than a grid that separates the base from the upper section. The idea being that the clean litter can then be easily shaken down into the lower part, leaving faeces and urine-soaked clumps on the top, which can then be easily disposed of. The potential problem with these is, as with litter tray liners, the cat can easily catch its claws on the grid, causing discomfort or even pain. The main problem with motorised self-cleaning boxes is that they can easily frighten and easily deter a cat from using the litter tray and from using other litter trays if they happen to activate when the cat is nearby, as we can see in this YouTube video, and I'd also like you to notice the effect that this has on both of these cats.
Milo doesn't like the electronic kitty litter box. Watch this. Yeah, I guess. It still looks dingy. Where'd they go, Milo? Better get it. Better get it. Better get it. Enjoying this bill. Let's just that out again. What? What's the matter, Stella? What's the matter?
Another question that very often comes up is, should we provide a covered or an uncovered litter tray? The answer is that it really depends on the personal preference of the individual cat, but there can be potential problems with using covered trays. For one thing, it's not quite so easy to see when a covered tray needs cleaning. Plus, odours can become trapped inside, which can then become a major deterrent for cats. Another issue in multi-cat households is that covered trays can sometimes allow for ambushing or trapping and can often be a site of conflict. An alternative to a covered tray, and one that I definitely prefer to use, is using a high-sided plastic storage box with one side cut down. This then provides the cat with an increased sense of security without it feeling trapped, and it's also much easier to see when it needs cleaning. Urine marking also comes under the heading of house soiling if it occurs in the home and in a location undesirable for the owner or caregiver, which is very often the case. The main things to note that characterise urine marking are standing on tiptoes, quivering tail, and alternate treading with the hind legs, which we can see here. The cat will also make no attempt to cover the urine. The quantity of urine produced is usually less than is passed during normal micturition, but this can also depend on how much is in the bladder at the time, so it might still be quite a reasonable amount. In fact, it can sometimes be enough to run down a wall and fall in sufficient quantity on the floor, causing owners to easily mistake this as being a product of squat urination, especially if the mark on the wall cannot be seen very easily. So why do cats urine mark? In entire cats, male and female, but more often on males, urine marking is used as a form of sexual advertising. Also, in both neutered and entire cats, when performed outdoors, it appears mainly to be a form of territory marking. However, when it is performed by neutered cats within their core territory, i.e. within the home, the predominant underlying cause appears more to be stress, especially social and/or environmental stress. Finally, house soiling can be linked to a wide range of underlying medical conditions. Urinary tract disease or any condition associated with a change in bowel habits are of course very possible underlying causes, but they are by no means the only medical causative or contributory factors. Any condition that causes an increase in urine volume or frequency can result in litter trays that need to be cleaned far more frequently, and if this doesn't happen, the cat may then be more likely to eliminate elsewhere. Changes in cognitive or sensory abilities should also be considered, especially with older cats. Pain and mobility problems can also be a common underlying cause. This might be because the cat finds it difficult or painful to access its preferred litter elimination area, or because it experiences pain when attempting to urinate or defecate, which then becomes associated with the litter tray. Feeling unwell or in pain can also be a major stressor, so this should also be considered as a contributory factors in cases of indoor urine marking. So that was just a very brief overview there. I hope I have provided you with a little bit more information than you before, but hopefully not too much, because we really would like to hear your questions and of course any comments that you might have. So it's now over to you.
Thank you so much, Trudi. That was amazing.
Okay.
Really good basic introduction to this topic of toileting in cats. What we're going to do now is move over to take some questions. So I will have a look and see if anybody has got a question, if they want to pop it in. I think I've got one person requesting to speak, so I'm going to try and nominate you. See how that works. Zoe, are you there? We think it might take a minute for people to appear, so we'll just give you a moment. Zoe has put a message up saying she's on a night nursing shift, so I'm hoping that she's not been called away to an emergency. Okay, well, hopefully Zoe might appear in a minute. In the meantime, I have got some questions here, so I'll read one of those out for you. So one of the questions we've got is, can you describe what you mean by blocking? You mentioned it a couple of times in the introduction.
Yeah, basically, very often happens in houses, especially where there is all the resources seem to be in one area. Which very often happens. You can have obviously the litter trays, the feed-in areas, the access to outside. Very often these tend to be located in one place. When this does happen in a multi-cat household, you can have one cat that will block the other cat's access to those areas. Or the cat may block the other cat's access to certain other areas, even if it's just a single resource in one place. What very often happens is the cat will just sit in the middle of a doorway, will sprawl across stairs. They don't look particularly aggressive, but they are just sitting and blocking the other cat's access to these areas. This can be a major sign of conflict between cats in a multi-cat household.
Okay, thank you. So I'm still waiting to see if we can get Zoe back on. Another question that I've got here was, litter trays are often placed in the utility room. Is that okay, or is that something that might cause a problem?
I always say, for one thing, I always say is, if it ain't broke, don't fix it. So if you have got trays in the utility room, it's not a problem, then okay, but it's good to be aware that there can easily be problems with trays located in the utility room. For one thing, it's very often where there are other resources, very often where the cat is fed, so the litter trays can be quite close to the feeding area. We can also have problems. I don't know if you can hear that. I've seen masses of sirens outside at the moment, so I hope you don't all hear that. It can also be where there is access to outside, so the cat flap might also be in the utility room, which is something that can be very off-putting for the cat to use in the litter tray. And the other thing is, very often utility room, we have washing machines, tumble dryers that can make an awful noise, and that can be particularly off-putting for cats. So utility rooms are though common area to put litter trays, and not generally the best area.
Thank you. Is there somewhere that you would recommend that people do think about putting the tray?
One place I very often find bathrooms can be quite good. It's very often a place that is fairly quiet. You don't get too much through traffic generally. They're only used occasionally. They're not used all day time. Well, hopefully not all day. And it's easy for the owner to actually clean the litter tray there. Problem is, sometimes there's not enough space. So sometimes you might want to maybe think of a spare room or something. Generally, litter trays should be somewhere where the cat isn't going to be disturbed, somewhere where it's not near any threats, and obviously not too close to other resources. It has to be a place where the cat feels safe and secure. That's the most important thing.
Okay, this is obviously a hot topic, litter trays, because I've got a couple of other litter tray related questions. The first is, what do you think about covered litter trays?
It depends. As I said in the talk, it's very much preference of the individual cat. Some cats really do like covered litter trays, some cats don't, but there can be problems with them. Majority of covered litter trays can be too small, and I really find that most commercial litter trays are too small for cats. The other problems with covered litter trays are that it's very difficult to see when they actually need cleaning. They can get easily missed when there's any feces or wet patches in there. Another problem can be, if you've got a multi-cat household, they're a great place for one cat to sit outside and they ambush the other one as it goes in or comes out, or to actually the other cat to be trapped indoors as well, trapped inside the litter tray. Also, because they are covered, they can keep the smells enclosed, which can be a great deterrent for cats as well. One thing I actually prefer instead of a covered litter tray is, as I said on the talk, these, the high-sided storage boxes. You can have one side cut down. The cat can feel quite secure in these because their sides are very high, but the top is open, so it's easy to see when it needs cleaning. The cat's not completely trapped in there, but it can still feel quite secure.
Thank you. I think that's a really good point. I certainly see lots of people when they have these covered trays that because they don't notice the smell as much, they don't realise that actually they probably need cleaning more often than a normal tray.
Definitely.
We're still on litter trays, I'm afraid, guys.
Yeah.
I've got. You said about putting 2 litter trays for feces and urine. Do you recommend them to be placed in the same room, distant from each other, or should they be in completely different rooms? And they've said thank you for the presentation. That was Sarah.
Right. So Sarah, that's yes and no. You will find, especially in a multi-cat household, I talked about blocking earlier. You can have problems where if you have the litter trays in one room, then you can have blocking by one cat into that room, so the other cat can't get into that room. But the other thing, as I mentioned in the presentation as well, is what can happen if the cat is one who does want a separate area. So they might urinate in the one litter tray, need to defecate because they start to urinate and then feel they need to defecate. But if the other litter tray is on a separate area of the house in a completely separate room, then they might not have any option but to actually move away from the litter tray they just used and defecate, urinate in the same room. So ideally, I would say if you've got a single cat, having another litter tray maybe in the same room but at a distance. In a multi-cat household, having other litter trays in separate areas of the house as well.
Brilliant. I have got a question coming from Zoe, which says, Is it stressful for cats that have flap access to expect them to only toilet outside, or should we be providing them somewhere indoors as well?
It depends on the individual cat. I mean, my cat is an outdoor cat. She only toilets outside. She does have access to a litter tray if she has to be shut in, or if we've got fireworks or whatever. It depends on your surroundings. If the cat is frightened by things outside, is reluctant to go outside, then you should notice that. And if the cat starts to toilet indoors, then yes, it definitely needs to have an indoor litter tray. But they've got adequate resources outside, and fine.
A question that from me personally, Trudi, I often wonder with cats coming into the practices who lots of these cats don't have a litter tray at home, and they're coming in and being expected to use a litter tray in quite a small space in the veterinary's context. And I just wonder if you had any top tips for people on should they be introducing a tray at home in case they have to go into those situations, or is there a better way? I sometimes suggest people put soil in them at the practice to try and make it more like they used to.
Yeah. I mean, I've usually found that it's got a natural thing for cats to do, but it can be very unnatural in vet practice.
Yeah, we find quite a lot of cats use their little litter tray
sit in there.
Bed.
Yeah. Well, the reason they sit in there is because that provides them with a certain amount of security. Although it's only sort of like maybe a couple of inches that they're surrounded by, but they're enclosed. So they often feel a bit more secure by sitting in that litter tray. If we can provide them with something, like one of these feline forks or something similar in the hospital kennel, though I know a lot of hospital kennels aren't anywhere near big enough. Or the other thing is maybe providing it if there's room with maybe 2 litter trays, one with some bedding in and one with a litter in. The cat might prefer to do that.
We do find some of them are quite stubborn. We give them a fork and they still quite like the litter
tray. And they still prefer the litter tray. Yeah, I think it's because they're enclosed. Because I know in practice we tend to use fairly small litter trays. Don't use, and so they just have this feeling of being enclosed in there. So I mean, maybe try, as I say, the extra litter tray and see what.
That's a good idea. Yeah. I've got a question from Kaylee. She said, I have a question in regards to approaching owners about suspected reason of house soiling being due to poor house hygiene. I have a case I'm helping with at the moment with an owner who doesn't seem to notice that the cat has urinated on clothing and bedding until she physically sees the cat doing it. The owner smells strongly of urine and doesn't realise it, and I'm finding it hard to speak to her about it. There are no obvious issues with litter tray placement or resource placements according to resource map and questionnaire. That sounds like a really difficult one.
Yeah, this sounds like one that needs a lot more sort of, needs a, I mean, Katie, have you done a house visit here? Is that a house visit you've been to? You type that in.
Just waiting to see if she responds. There's a bit of a delay between us speaking
right.
and getting us.
Let's just have a look.
While you're waiting for that, Kaylee. Oh yes, she says yes, she has been out on a visit.
Okay. Yeah, I think this is, you know, really something that needs a lot of counselling of the owner, doesn't it? I'm just reading the question again.
It's possible the owner's got something wrong with their sense of smell, isn't it? So that would need very tactful exploration.
Yes. Yeah, definitely. Although I will admit that you do tend to get, I mean, I know that I'm sort of a bit nose blind when it comes to cat urine. I visit other people's house and they say, oh, sorry about the smell of the cat pee, and I'm going, sorry, I can't smell it, you know, because I'm just so accustomed to it. But I think it might be the same with this owner. So it's, yes, just been very tactful and difficult one, I'll admit.
Yeah, I think quite a lot of cats that do urinate on things like clothing or bedding on the floor or left out, and perhaps having a discussion about keeping those things out of the way or shutting the cat out of those rooms just to minimise the chance of that happening might be an easy first step, perhaps.
Yeah, I mean, also looking at where the litter trays in the house are placed, you know, because, you know, looking at the general litter tray issues, I mean, if there are particular litter tray issues, then the cat's going to go somewhere else, definitely. But cats, yeah, sorry.
I was just going to say, would it be worth possibly getting something like a black light? I know it's always very scary when you do that, but it might be another way of detecting soiling without having to smell it.
Yeah. Another thing I do need to be aware of, I've come across, there are certain house plants that can smell quite like cat urine, and I've had
privet.
It wasn't privet, I forget what it was. I did visit a house once where we searched everywhere, and the poor owner got to cleaning absolutely everything and completely clearing out a house, and we actually identified it down to a particular house plant.
Poor cat's getting the blame.
Yeah, it was the plant.
We've had a message from Kaylee saying thank you very much and sorry for asking the awkward question.
No, don't worry. No,
awkward are often awkward though, so we're kind of used to that. I've had a couple of good suggestions come through from people. Sarah said that soil has worked well for her when she's used it, and Kaylee said that footstools with a Feline scented blanket make a good alternative to forts, and I think some cats do quite like that, don't they? They quite like a covered thing.
Anything gives them.
We've used sort of squarish, rectangularish recycling baskets on their side in kennels because cats can go in them or on them. They work quite nicely.
Yeah.
I mean, even just a cardboard box is better than nothing.
Yeah, definitely. And if it's a kennel with a shelf, then draping a towel over, you know, sort of wedging a towel at the top, sort of, you know, anchoring it and then wedging it and let it hang over.
Yeah, there's lots of things. Oh, Zoe, who initially tried to ask a question and may have been called away for an emergency, has now come back. She said, I've been asked to help with a house soiling case in a multi-cat household where one of the cats has been doing it for a few years. The vets have put her onto amitriptyline but didn't do any behaviour modification. Obviously, if the stressor is within the cats in the house and the pharmaceuticals aren't helping, is it a problem that is never going to go away? I've had a long telephone conversation over lockdown and I'm going for a visit next week. Is there anything you can suggest to help her?
Exactly what she said, that without addressing the underlying cause of the problem, medication's very unlikely to be successful anyway. But the other problem is that amitriptyline, it's reasonable at reducing pain. It has some pain reducing effects, but very little fear and anxiety reducing effects. So if the underlying problem is causing anxiety, amitriptyline is not going to be that effective anyway. So yes, there's a lot that could be done, and the fact that that case hasn't responded just to giving one cat amitriptyline is no indication that it's not going to be resolvable. Sorry, Trudi, you were going to say.
No, I was actually going to pass it over to you. So yeah. Mention drugs.
Well. It's like we know what we're doing. I've got another one here, which was, why would a cat that has always eliminated outdoors suddenly start to urinate or defecate in the house? You could be there all night, guys.
Yes, yeah, it could be absolutely anything. So yeah, we could have a cat that has been into conflict with other neighbourhood cats. We could have a cat that urinates, defecates in the neighbour's garden, and they suddenly have got a dog. There could be building works going on outside. We could have a cat that has developed mobility or pain issues, musculoskeletal pain issues, and then finds it very difficult to get outside, or finds it very difficult to get away from any threats it comes across outside. We could have a cat that has been disturbed by its eliminating outside. We can have a cat that suddenly doesn't like the weather. I've had cats that no house soiling issues at all until it's been raining for 3 days, and then suddenly you have house soiling issues. We could have a cat that has got sensory issues. We could have one that has a cognitive decline, a cognitive dysfunction, and can't find its way outside anymore. List goes on and on and on. So basically, if you've got a cat that starts to eliminate indoors, number one, provide it with a litter tray. Make sure we're giving it all it needs by way of litter trays inside, and then maybe start to investigate as to what might be going on outside. I know that there is some ongoing work being done in Lincoln at the moment, should be published fairly soon, has actually found that providing sort of outdoor enclosures, cats with having the cat must have direct access, but having an outdoor enclosure or cat-proof gardens can make those cats feel much more secure within these cat-proofed areas, as long as they're quite large enough. And so if you have got a cat that's been feeling quite fearful of going outside for whatever reason, then cat-proofing the garden might actually be the way forward, possibly.
Excellent. I think that's a pretty comprehensive answer. I guess sitting here as a vet as well, I'm thinking probably to just make sure you've ruled out all those medical causes, because like Trudi said, there's a whole heap of medical things that might be going on there as well.
Yeah.
I've got a couple of other questions coming in. One that I thought was really nice is there a reason why a cat would choose to defecate in the bath, which does seem to be quite a common one. She says that she believes the behaviour is due to stress in the home, but curious as to why they might choose the bath.
Right. There was an old theory that the cats are attracted to the smell of the drains. I'm not ruling that one out, but I don't think that is. You mentioned stress in the house. Quite likely, this is probably because the cat has found somewhere, one, the urine disappears, which the cat would want it to do. Obviously not feces so much, but I think the main reason why they do this is because you've got the nice high sides of the bath. So that actually makes the cat feel a lot more secure.
Yeah, I think that probably is a lot of it, isn't it? We have another one, which is from Sarah, saying, what is your first choice for drugs in the case of a multi-cat household where fear or anxiety are related to the problem?
I guess drugs wouldn't be the first port of call in that situation. It's much more important to try and address the underlying reasons for the issues in the multi-cat household, making sure the environment is as good as it can be, resource provision is as good as it can be. And if there's still a lot of stress and anxiety, then perhaps you might be considering the use of medication. It is a difficult one. I don't tend to use medication in issues in multi-cat households very often, because often you're either going to get it right with getting the environment and resource provision and everything right, and that's enough to reduce stress, or things are so bad that actually if you've got a cat that's really badly not coping, living with other cats, then you're probably going to be thinking of rehoming. So I'd probably only be using medication if I felt that there was a good chance in the longer term that these cats could live together without stress, and that you could actually make sufficient changes with the environment and everything else to make that happen, in which case then yes, using medication to support that might be right. And probably, you know, my usual first go-to choice would be fluoxetine for cats that are anxious and or frustrated. Some people might prefer clomicalm, and I think from a toileting perspective there isn't a lot of difference between them. I think there have been studies comparing efficacy of clomicalm and fluoxetine for various house soiling problems, and they're pretty much similar. The other option you've got is buspirone, Buspar, which can be quite good for cats that are very fearful. If your sort of relationship has broken down, you've addressed the problems, the cat that was perhaps being the bully, if you like, has settled down, but you've still got a cat that's very fearful and perhaps continuing to use avoidance behaviours, which is preventing your behaviour modification plan going right. Buspirone can be quite useful for that more timid cat because it can increase confidence, and it appears to have a little bit more of a direct effect on social behaviour. It tends to encourage social interaction, so it can sometimes work. But as I say, medication shouldn't really be the first consideration in that sort of case. Would you agree?
Yeah, definitely is. Yeah, really try to find the underlying causes, address obviously address the underlying stressors, address the conflict issues between the cats, you know, before we begin to consider medication. Definitely. So do you agree, Emma?
Yeah, I was just listening and thinking this is a typical one of those where you know there isn't a definite right answer, because I do tend to use clomicalm. So clearly there probably isn't a huge difference between the medications.
No.
And I tend to find the ones I'm using it in are the ones where actually we got a really good response to behaviour modification initially, and then it's broken down again because of some external factor, and then we've gone to medication, because I know those cats can live together and have a relationship. So yeah, I think it's choosing your cases and making sure you've got the behaviour mod in place as well.
And sometimes the choice between clomicalm and fluoxetine is going to be whether you can get a tablet down a cat or get the cat to take liquid, isn't it? Yeah. It's more of a sort of practical issue.
Do you use the little gelatin capsules with the liquid, or do you find cats will take the liquid okay?
Some take it. It normally needs to be in something particularly sort of strong tasting and smelling, and that the cat particularly likes, like, you know, sardines or tuna or something like that. But yeah, some cats will take it, but if they don't, then the gelatin, putting it in an empty gelatin capsule can be good, as long as obviously the owner can get that down. Yeah.
Okay, I've got another medication related question, so I'll pass that one on as well. Vicky said, I heard a vet behaviourist in a podcast once discussing SSRIs in the context of house soiling, but it was advised against paroxetine in male cats as it might increase the risk of blockage. She said she's tried to locate a source for that but been unable to, and she was wondering if Caroline maybe had any advice on that.
I think any serotonin increasing drug can potentially interfere with bladder emptying. But actually, I think out of the two, clomicalm is more likely perhaps to do that. I mean, it won't happen every time, but I think any cat that's on clomicalm and potentially on SSRIs, the owners do need to be aware to monitor urination, and obviously, particularly in male cats. I don't think it's very common, but it's certainly a known side effect, particularly with clomicalm.
Okay. We've got a slight change of tack. I've got a question that said I've had a few owners who are cleaning urine marks with vinegar. Have you come across this? I usually suggest dilute 10% biological washing solution or a ready-made product.
The vinegar thing is because ideally you want to initially clean with some enzymatic product, so either something that's ready made or you say the 10% washing liquid, and then after that then just go over with some form of spirit, and of course vinegar is a spirit. I will normally recommend something like surgical spirit rather than vinegar because the house smells like a chip shop otherwise. So yes, but not in place of the biological washing solution or the ready-made enzymatic product.
Okay.
But afterwards.
Yeah. Okay. That's fine. And I've got a question about Feline, so the pheromones. Can they be useful to help resolve house soiling problems?
Yes and no. Feline can be useful to actually encourage a cat to use a litter tray, because we can make that area around the litter tray feel more comforting, more attractive for the cat. So a Feline diffuser placed near a litter tray may actually encourage it to use that litter tray. The other thing is, if we've got urine marking, then a Feline may be part of the jigsaw puzzle, as it were, towards actually addressing underlying stresses and making the cat feel a bit more confident. But I say it's only sort of part of the jigsaw puzzle. It's very, very unlikely to work on its own.
Okay, thank you, Trudi. Do you have any preference for the version of the pheromone that they use? Do you like the diffusers or the spray? And have you used the Feline friend?
I think it depends on how we use it. I mean, if I'm saying about reducing stressors, so if we have multi-cat household conflict, then obviously the Feline Friends is going to be useful for reducing that stress. But you can also use the Feline. You can use them both together. A lot of people tend to think, which one should you use? But if you've got multi-cat household issues, and you've got underlying other stresses as well, then yes, you can use both of them together.
Okay, thank you. And do you use the spray as well in particular areas, or just using the...
It depends on what you want to use it for. I mean, if it's you're targeting a particular area, targeting a particular spot. So let's say we're trying to attract a cat into using its carrier, then you're probably best to use the Feline classic spray, into the carrier or onto the bedding you want to attract it towards. But if it's just an overall general trying to, reduce overall sort of calm, then using the diffusers are much better.
Okay, thank you.
And actually, just again, what you said about potentially making the cat feel more secure using a litter tray, having a diffuser near the litter tray for cats that are either worried about doing it or they've had FIC or something that's caused them to be worried, that can work quite nicely.
Yeah.
Okay, thank you. I think that might be all the questions that I've got coming in on the chat at the moment. So I'll just ask you, has anybody got any more questions that they want to put to Trudi and Caroline while they've got them pinned here ready to answer? Oh, hang on. I'm just going to check back and make sure I haven't missed anyone. So bear with me just a second. No, I think we're okay.
Okay.
Brilliant. Okay, well, while I'm just waiting to see if any more questions come in, I've put up the poll and lots of people have responded, and I've got some responses on there. So it looks like most of the people here tonight are either behaviourists or veterinary nurses, with a reasonable number of vets as well. So what we need to do is try and get some of the receptionists and support staff in for the next session. So we'll try and push that a little bit and see if we can get some of those people along as well. Obviously, this is a really interesting topic, and thank you so much to both of you for doing this. I know it's a bit hard to be put on the spot like that, so thank you so much for stepping up and being brave and taking this session. We're having a few people coming through on the chat now saying thank you very much for taking their questions. We will be running some more of these sessions, so if anybody has a topic that they particularly would like to be addressed, if they contact us at the FABC, then we can hopefully try and get on board and do some of the things that you're interested in, and hopefully convince some others of the vet committee to be brave and come and take some questions for you. And thank you all so much for coming along and listening and taking part and asking some really great questions. We have got a CPD certificate for this evening for people who've attended, which I'm just hopefully about to share with you, and you should be able to go in and download that as a file. So that should be coming up any minute for you to get, hopefully. Oh, there we go. Yeah, and Sarah's just said, are you planning to do another session like this for other topics? We absolutely are. And if you want to quickly type in the chat, if you have a particular topic that you would like addressed, or contact us at the FABC, then we will be delighted and hopefully be able to answer some of your questions. Otherwise, I think we might be saying thank you and good night for today. I'm just giving you a minute to see if you typed anything. Lynn said, brilliant, thank you, Trudi and Caroline.
Oh,
thank you, Lynn.
That's kind.
Excellent. Right, well, I might, we got people saying thank you, and they're going to think about topics, so we'll hopefully have some good topics for another day.
Excellent.
Yeah, I saw that Zoe earlier asked about behaviour qualifications. I've sent her a private message saying if she wants to get in contact with us, we can discuss that. But I don't know, did we want to... Oh, there we go. Zoe's come back on. She said she's done her ISFM behaviour cert and now halfway through the Compass applied feline behaviour diploma, but she hasn't got a degree. And I think she's just looking for recommendations and what we thought was a good thing to do.
Well, you've done your ISFM, so that's a good one.
Yeah, I mean that is a really good course. Zoe, are you wanting to work as a behaviourist, or is this just to go alongside your vet nurse work, and just so we an idea of what you're aiming to do? If you're really interested in taking the behaviour side further, if you wanted to contact our mentoring committee member, then they'd be really happy to have a chat with you about how we can support you and help you. Oh, Zoe said, does that mean that she needs a degree to even be recognised?
No, I don't. I mean,
I don't know. I think
we need to can do the course mapping, can't you?
Yeah, so at the moment, in order to obtain a qualification and to be listed with the ABTC, then you need to do one of the courses that qualifies, and you can contact us and we'll be able to go through the course mapping and things with you. I think Zoe's just stuck up the office email address for you there. So what I would suggest is that you email and ask to be put in contact with the mentoring committee, and then they're really helpful. Deborah's lovely, and she'll be able to go through with you exactly what the best steps for you are and the best way to go about getting yourself recognised and on the lists. Hopefully that will be able to answer your questions. We've got someone saying that they'd like to do further sessions about multi-cat households, which I think definitely would be something worth doing. And somebody else has suggested doing one about dog and cat integration, which might be nice as well. So lots of ideas for us there to be working on.
Yay.
Lovely. All right, well, thank you all very much, everyone. I'm going to say good night for tonight. If you do suddenly think of a burning question, if you email that email address that Zoe stuck up for you, then we can get that passed on to the relevant person and hopefully get back to you and give you some advice. We are hoping to do a little synopsis of the questions that came up tonight, and we will send that round to people so that you've got a little reminder of the topics that we talked about and the advice that was given. Thank you all very much for attending. It's lovely to see you all here, and I hope it's been helpful for you. Good night.
Good night. Thank you.
Night all. Night. Night.